this is a follow-up testimonial to show how the results are after 10 months. And tell me first about your symptoms before the surgery.
Before, they kept getting worse. I couldn't find a doctor that would listen to me. It was debilitating me to where I couldn't do anything. I was using a walker, crutches. I've had injections, chiropractic, acupuncture. I did everything possible.
How long was it?
5 years.
5 years.
And I kept getting the MRIs done, and they kept saying, well, it's this, it's this, it's this, but nothing was being done about it. They just kept doing the injections.
Were you as well taking medication?
Medications, I was on pain medication forever, which was obviously, that's debilitating.
Yeah, absolutely.
Muscle relaxers, you name it, they treated it with.
How was your daily activity in the last 6 months or so before the surgery?
Minimal. I mean, very minimal. I had to get help with everything. I couldn't dress myself. I mean, I didn't cook, couldn't stand, couldn't walk distances or anything.
The surgery was about 10 months ago.
It's September 7th. I remember that day.
And then that surgery was done in a minimal invasive fashion.
Yeah.
And how long did you stay in the hospital?
I was in the hospital, I believe, I don't remember all of it. I was there for 4 days, and then I was transitioned to a nursing home for rehabilitation. But I asked you to release me after 2 weeks because they weren't rehabilitating. I got more rehabilitation by dealing with you and my in-home staff.
Yeah. And how long after the surgery did you start walking?
Actually, my mother would come down and would have me walk right away a little bit, at a time as I could, and then lay me down. But as time had went on, I started increasing it, and then the physical therapy and that bone growth stimulator I used, and I would, like I said, I set my watch to, for goals to take steps.
Yeah. How is your daily activity now? Where are you?
Oh my goodness, I use no walker, I use no cane. I am driving as of now again. I don't take any pain medication, I don't take any muscle relaxers. I can do a lot more. There's still a certain bend point that I'm working on, but like you said, it's only been 10 months.
Yeah.
And
you told me as well about in your surroundings some people who have back pain that they were amazed how fast you or how far you have come. Tell me about it.
Yes, they would say, if they have back problems themselves, they would say, I'm not getting back surgery, that's just, and I'm like, wait a minute, this was minimally invasive. I had hardly any, scarring, or I don't even care about the scarring. I cared about the outcome. And I said to them, it's like, I should have had this done a long time ago. So now they're looking at me like, wait a minute, you're doing all of this stuff, and I'm like, I'm starting to function back as a normal person, normal activity, normal movement, cooking, cleaning, laundry.
So you gained your life back.
Yeah, I did gain my life back.
Excellent. I'm going to look at the films with you. And this is a surgery that we did from L3 to S1, minimal invasive with olive technique. We put the spacers in, and as we see here, the bone inside of the spacer is growing as well. The bone outside of the spacer is growing. So the fusion is what we call interbody is completed. As well, the bone is growing in the back, so we achieved both. We doubled it. We made the bone grow in front and the back. Here's the bone growing in the back. And if we go further to the front, as well, we see that the bone is as well solidly growing in the front. And all of that we did with a smaller incision, and the recovery is obviously faster, but as well, because we are not disturbing the back, this is still live, healthy tissue that can recover faster. Well,
and I can breathe. You know what the funny thing is? I can breathe. Like literally, I can breathe. Before I was breathing with pain all the time. Like I take a deep breath, and the pain would shoot, and the pain was shooting all the way down my right side to my toes.
That pain is gone in the leg?
Gone.
Excellent.
I have none.
Excellent. No, the thing is, in many occasions, sometimes for us to do the surgery, we cause lots of damage to do the surgery. And I think the special thing about this was that we didn't.
No, you definitely didn't. At first I was scared when I came to from the surgery because I didn't know what to expect. But the healing process, following the directions you told me to follow, and the rehabbing part of it, all of those things take a part. And so I have followed in this short 10 months,
Mhm.
I have followed everything, and I'm so grateful that I had it done, and that I found you, and somebody actually went in and did something about it.
Thank you very much for the interview.
You're
okay?
welcome.
Thank you.